Cityofenid. It's Maggie Jackson with the Garfield County Health Department. Just here for another quick COVID-19 and health update for you for October. Wanted to share that we are still on the downtrend for our COVID-19 numbers. I'm so thankful that we are seeing those blue little dots there in the corner. That's our cases going back down. So we're at 180 active cases of COVID-19, which is better. I think there were 300 or so last time I talked with you all. You might have seen in the last week there was a kind of a catch-up. Oklahoma, we review each and every COVID-19 death before it's reported. So sometimes there's a bit of delay before those deaths are reported. So unfortunately, we have passed 200 deaths in Garfield County now. There was a big jump this week to 206 deaths have happened in our county since COVID-19 began. But 10,200 people have had the virus, so that puts our percentage pretty high. So COVID-19 is still spreading in our community, but fortunately we're down to that 180 cases. So things are looking up. We're seeing that kind of curve of the Delta variant improve across Oklahoma. So I'm thankful for that. I just wanted to let you know that 62.3% of our neighbors in Garfield County have had at least one dose of COVID-19 vaccine, and 53% are fully vaccinated. So you're still in the majority. Lots of people are coming still to get a booster dose. We've had 1,900 people come for their booster or their third dose. And we are still under the state as a whole, but Oklahoma has 58.9% have had at least one dose of the vaccine. So we're doing about the same as the state. So thank you to my Garfield County neighbors for doing your part, getting your vaccine to protect yourself and our vulnerable community members. Just something to share. I know there are some people who might still be deciding whether or not they want a COVID-19 vaccine, but these numbers are from September, so we'll continue to see updated data. But people who've had their full course of vaccine, that's 2 doses of Moderna or Pfizer, they are 5 times less likely to become infected with COVID-19. Yes, you can still become infected with COVID-19, but you're 5 times less likely because you may not have symptoms or as severe symptoms. You're also 10 times less likely to be hospitalized and 10 times less likely to die. So it reduces your risk of hospitalization and death. So yes, we have seen people in the hospital that have had their vaccine, but the risk is much, much, much lower if you've had your vaccine. So I wanted to share that with you all. If you're still deciding, we have boosters available. So for anyone who received Pfizer, you've been able to come for a booster dose. That's anyone over 65 or has works in a healthcare setting, a long-term care setting, in a place where they're high risk, where they may be exposed to COVID-19. We suggest coming to get a booster dose 6 months after you have had your second dose. Now, just this week, news that Moderna and Janssen, or J&J, as we refer to it, are also now recommended to receive a booster dose. So Moderna is very similar. If you had Moderna 6 months or more ago, how do you say that right? More than 6 months ago, you are eligible to come for a booster dose. We recommend it for people over 65 and those who are over 18 who work in those high-risk settings again. Anyone who had Janssen or J&J, that was a 1-dose vaccine, but we've shown that it can be much more effective if people do get a booster 2 months or more after that vaccine. So some updates for this week. Every day you can walk in at the Garfield County Health Department for a vaccine. If you prefer to call ahead, our phone number is right there, 233-0650, or you can go to vaccinate.ok.gov for an appointment. There's also so many providers, especially that have the Moderna vaccine. That one's easier to store. So lots of our local pharmacies and Walmart. I know Evans carries it. Many of our hospitals and providers also have it. So give them a call as well if you prefer to go to one of those locations. Getting a vaccine is not hard these days. And we just wanted to say happy Halloween. Last year, Halloween looked a little bit different for some of us. We tried to be more cautious. I still recommend if you are, have older family members, or, your kiddos are coming to your house to get candy, that, take precautions. If you have not had a vaccine, we recommend wearing a mask. If you have, weigh your personal health. And if you, being outside is a lower risk situation, but we still want to make sure that those COVID cases continue to go down. So stay safe as you celebrate Halloween, but have a blast, and we hope you enjoy it. There's so many fun events going on in Enid this weekend, haunted gym and lots of trunk or treats. So if you still haven't had a COVID vaccine, we're doing some mobile events this week. Next week, we'll be at Autry Technology on Monday. So we're trying to get flu and COVID vaccines out and make it easy for you to get one. Don't forget about your flu shot. Last year, we saw flu cases go way down because we were taking precautions for COVID. And so we just want to, hopefully that is the case this year too, that we have low flu numbers. But one of the ways that we prevent a lot of flu cases and flu hospitalizations is by getting a flu shot as well. Lots of places to get a flu shot. You can come to the health department. You can go to a pharmacy. Most of our physicians, wherever you get it, just grab one. Now's the time. So we don't have both of those viruses going through our community this winter. I wish you a fun Halloween, and thanks for listening, and stay healthy.